Welcome to Bite Size Dental Marketing. Today I have Andre with me, and we are going to dig into the importance of Google reviews for your dental office. Andre, how's it going?
It's going good, man. And Google reviews are one of the most important things when it comes to marketing strategy, just because consumers want to know if what to expect in a practice, if other people have had good experiences. So we really harp on this with all of our clients that you have to get good, a good number of Google reviews.
Yeah, I find even when I'm recommended something, my daughter had some allergies, and we had a couple of doctors recommended to us. I still found myself reading reviews, and it was from other people in the medical field. Yeah.
Yeah, and offices, for some of them, have a hard time getting Google reviews or asking for it. I think that the best way to get them is to not only mention them in the office, with the doctor themselves, the front desk, make it personal, make it feel like they're doing a favor to help you grow the practice, because people respond to people the best. But I also think it's important for them to have a tool that automatically asks for the review, because we see very often that they'll do a competition or a little campaign in the office to get to a certain number of reviews, and everybody starts off really excited, but then 3 months, 6 months from now, they forget all about it and they're not getting reviews anymore. So I recommend that most of our clients have some mechanism, whether it's bird eye or swell, any of those kinds of tools to keep the flow coming.
Yeah, I think you're being generous with your 3 to 6 months. I think it trails off after like 2 weeks. But reviews are interesting to me. I know that as I'm looking at reviews for a product, I'm really just probably looking at the number of reviews and how legitimate. A few years ago, when I'm looking for a service base, I tend to look for the negative reviews that may align with my situation or my personality, perhaps even. And then I judge the merit of the negative reviews, and then I look at the overall rating. I guess I look at the overall rating first and then judge the merit, but then I discount them if they don't apply to me.
Mm-hmm. And I'm curious if you're this way too, Eric. I use this analogy often. We all shop a lot on Amazon these days. And when I'm looking for a product on Amazon, if I see two products that look similar, but one of them perhaps has 50 reviews, but with a 5-star rating, and another product's got 10,000 or 20,000 with a 4.8, I typically tend to click on the 10, 20, 30,000 product first, because it just feels like a lot of people have tried this and I'm not alone. And I think humans in general have this herd mentality kind of thing, right? And so I think it's important to have good quality, but also having a volume of reviews that lets you stand out from the competition in your area. Right. So if all your competitors have 20 reviews, you might do great with 100. But if everybody's got 300, 100 is not enough. So I think that matters too.
Yeah, I agree. I think once it gets into the hundreds, I know that you don't have enough family members to make it happen. You probably get legitimate reviews. I do not trust the 5 stars with no comments. I do think there's some potential, buying that can be done. But I think when I look at a review, I think you're right. I definitely go for the highest number, and then I filter how applicable those would be to me after I look through them. But yeah, if there's a difference in 300 versus 100, it is the 300 reviews product or service to lose at that point.
Yeah. Now, I have a pro tip. If you're a doctor and you're listening to this right now, do not review yourself. Do not have your wife review you, because we have had an instance where a doctor was like reviewing his own profile, talking about how amazing this doctor is, and a patient caught on to that and called him out, and that's just not a good look. So make sure that these are legitimate reviews from legitimate patients, because you want that credibility.
Yeah, I think that's an awfully quick way to undermine credibility, is to have a staff or a doctor review their practice they are at. Ask a patient. Now, I think if they want to go there and say, I work here, I trust this doctor, I think I would let that go, but I don't think a doctor should review themselves under any scenario. Yeah. Well,